since you've got back and you've been talking to media here in Taiwan, you've called for a ceasefire. There was a pause, a truce between Israel and Gaza, and that's now collapsed. Can you tell us why you were calling for a ceasefire?
From the perspective as a doctor or from the perspective as a medical humanitarian organization, it's nonsense that we stay in the hospital and we tried our best to save 1 or 5 or 10 lives, to do our best to save them. But at the same time, the war is still happening and hundreds of thousands of people are still dying. I think it's unacceptable and it's nonsense for a doctor. So I think the ceasefire is essential.
And one thing we've been hearing from reports of Gaza is the Israeli attacks on hospitals. Can you tell us what you know about these?
Since the start of the war, according to the statistics of WHO, it's over 100 accidents of attacking the medical facility. MSF, we have our own medical facility in a hospital called Al-Auda. It's in north part of Gaza. This place was also attacked, and 4 of our staff died from this accident. Even before the attack, they are doing the operation, they are treating the patients inside of the hospital. So I have no any idea, and I cannot think of any reason why this place, the international neutral organization, independently operated medical facility would be targeted. And I think this should be further investigated.
Can you tell us a bit about what you saw in terms of the Palestinian people in the Gaza Strip, in terms of their medical needs? What sort of situations were you seeing from the people there?
Even only the first or the second week of the outbreak of the war, there's almost no any medications. We need to suture the patients without any local anesthesias because we run out of the medication. So we have 2 children. They are older sisters and younger brothers. Their house was bombed, so all of the other families are died, and they are no more than 10-year-old, and both of them need amputation because the injury of the limbs. But we run out of the local anesthesias, so we have to do the operation for both of them. And the older sister, she has to hold his younger brothers. I mean, it's this kind of suffering or pain, it's unnecessary for us. We can do more to prevent this kind of tragedy.